Welcome to the deep dive. Today, we're embarking on a really fascinating exploration into hyperbaric oxygen therapy, HBO for short.
That's right.
And specifically, we're going to try and unravel how this therapy interacts with our blood, and also the intricate workings of our immune system.
Yeah,
Our guide for this is, well, it's a detailed chapter focused right on these effects, HBO and hematology and immunology.
exactly. And our mission, let's say, is to really get beyond just the surface level. We want to understand the science, how boosting oxygen under pressure actually influences all those different blood components.
Red cells, white cells.
Right, the red and white cells, platelets for clotting, even hemoglobin itself, the molecule carrying the oxygen. And we'll also look at some, well, maybe surprising effects on our immune defenses
Okay.
and what potential breakthroughs this could mean for treating certain conditions. I think there are some quite illuminating connections to unpack here.
Sounds good. Okay, let's start with maybe the workhorses. Red blood cells, we know their main job, oxygen in, CO2 out.
The basics, yeah.
But our source really highlights something critical,
Hmm.
their flexibility. Deformability, I think, is the tool.
Deformability, yes. It's crucial.
Think about it. These tiny cells have to literally squeeze through incredibly narrow blood vessels. So how easily they bend and twist is, well, it's a huge factor in how smoothly blood flows, especially way down in the microcirculation.
And what's really interesting here is that some research suggests that at pressures just a bit higher than normal air pressure, so below 2 atmospheres absolute, or ATA, think maybe like being a few meters underwater,
Okay.
this deformability can actually increase in healthy people when they're exercising.
Oh, interesting. So better flow.
Potentially, yeah.
Yeah.
The idea is it could lead to better oxygen delivery to tissues, even if the red blood cell count, the hematocrit, is a little on the low side, maybe around 33%.
Hmm.
But, and this is important, when you push the pressures higher, the results on deformability get less clear, sometimes even contradictory.
So it's a bit of a balancing act with the pressure. Not too much, not too little
Yeah.
for that flexibility.
Seems that way.
Okay, now how does the oxygen actually get picked up and dropped off? That's the hemoglobin molecule inside the red cell, right?
That's the key player. It grabs onto oxygen in the lungs, a loose reversible bond the source stresses, like a
Right.
temporary handshake.
Right.
And then it lets go wherever oxygen is needed in the body. That reversibility is absolutely fundamental.
So what influences how quickly that happens? The uptake and release.
Well, several things. The surface area of the red cell matters how much doorway there is for oxygen to get in. Then the amount of hemoglobin packed inside determines the total carrying capacity.
Okay.
And then you have intracellular factors like acidity, the pH level, and also a molecule called DPG.
DPG. I remember that.
And
It affects how tightly hemoglobin holds oxygen.
exactly. It's like a little regulator inside the cell. Interestingly, the rate of oxygen uptake seems more dependent on that surface area to volume ratio, but the release of oxygen, that's more sensitive to the pH and the DPG levels. And under hyperoxic conditions, like in HBO, this oxygen release actually becomes most efficient at certain specific oxygen pressures.
Okay, this is where it gets really interesting for me. The chapter talks about actual changes, structural and biochemical, that can happen to red blood cells with HBO. Things like, well, hemolysis, the cells actually rupturing.
That's mentioned, yes.
Mhm.
Potential hemolysis. Also, a possible dip in the hematocrit, the overall red cell count.
Damage to the cell membrane.
Peroxidation.
Yes, altered membrane phospholipids, potentially through peroxidation. This flags up, the question of oxygen toxicity, especially with higher pressures or longer exposures.
So what happens inside the cell then?
Well, under these high oxygen conditions, studies suggest we can see decreases in energy molecules like ATP and that DPG we mentioned.
Which would affect oxygen release again.
Precisely. It
Yeah.
affects hemoglobin's affinity for oxygen. We also see a potential early marker of oxygen toxicity. The turnover of those fatty acids in the cell membrane slows down.
And certainly in animal studies, if you expose them to prolonged high pressures, like over 3.5 ATA, you can see red blood cells becoming deformed and even rupturing.
Wow.
There's even a note about changes during oxygen-induced seizures, potentially related to a drop in an antioxidant enzyme, SOD, and more free radical formation.
But it's not all negative for red cells, is it?
Sure.
The source mentioned something about stored blood.
Yes, that's a fascinating potential upside. It seems HBO might help preserve stored blood. Red cells stored cold, at 4 degrees C, but under 2 ATA pressure for 3 weeks showed better resistance to breaking down to hemolysis.
How?
Well, the thinking is the pressure might slow down the cell's metabolism, helping them conserve energy while they're in storage.
That could be huge for blood banks.
Potentially. The source notes positive effects on pH, stability, glucose levels too. It suggests HBO could be a tool to, extend shelf life or improve the quality of stored blood. Definitely an interesting area.
Okay, shifting slightly to hemoglobin itself. Its job is oxygen transport, we know that. What does hyperoxia do to it directly?
In healthy people breathing high oxygen, there might be a very slight decrease in hemoglobin levels, and maybe a slight increase in ferritin, which stores iron.
Why?
Possibly just a temporary shift in how the body's handling iron. But the key point the source makes is that these changes are generally really small, probably not clinically significant for typical HBO treatments.
Okay, that's good to know. What about making new red blood cells? Erythropoiesis.
Right, that's mainly stimulated by the hormone erythropoietin, or EPO. And EPO release is regulated by tissue oxygen levels. Low oxygen triggers more EPO.
So high oxygen, less EPO.
That's what some studies suggest. There's one mentioned where volunteers got a brief, very high-pressure exposure, 7 ATA, and their EPO levels were suppressed 24 hours later.
Hmm.
And an animal study in mice kept at 4 ATA for a full day showed suppressed red blood cell production. It couldn't even be kick-started by giving them extra EPO.
That sounds potentially concerning.
It does, but again, context is key. These are pretty extreme conditions, very high pressures or very long exposures, not typical clinical protocols.
Right.
The source actually reassures that the shorter, standard clinical HBO sessions are unlikely to cause a meaningful drop in a patient's red blood cell count.
Okay, that is reassuring. So what about the overall picture of blood flow hematology in actual patients getting HBO?
Well, there's a study cited looking at patients who had 20 HBO sessions. And yes, they did see a significant decrease in hematocrit and red blood cell count over that time.
But
And this is crucial, other factors affecting blood flow, like that red cell deformability we talked about, or blood viscosity, didn't change in a way that was considered problematic.
so fewer red cells maybe, but the blood still flowed okay.
Essentially, yes. No significant negative impact on the blood's ability to flow smoothly seems to occur with typical treatment schedules, despite the drop in cell count.
Okay, let's pivot now to the immune system. White blood cells, leukocytes. Our source seems to show, well, a bit of a mixed picture here.
It does. You see some experimental studies, often in rats, suggesting that HBO might cause some metabolic issues in certain white blood cells, polymorphonuclear leukocytes, and maybe impair their functions slightly.
But not in humans.
Well, that's the interesting contrast. Human studies looking at repeated HBO exposure haven't shown a negative influence on the function of other key white cells, like monocytes and lymphocytes.
Hmm.
It really highlights that you have to be careful extrapolating directly from animal models to humans, especially with something like HBO. The responses can differ.
Makes sense. Okay, what about platelets and blood clotting? The source mentions some potentially serious issues under certain conditions.
Yes, it notes that under some probably quite extreme hyperbaric conditions, things like blood clots, thromboembolic events, and even DIC, that widespread clotting disorder, have been observed, which definitely sounds alarming.
It does.
But then it digs into more specific studies. For instance, one looking at isolated horse platelets found no real detrimental biochemical effects or oxidative stress at 2.2 ATA. However, a study in human patients getting intermittent HBO at 2.4 ATA, a common pressure for wound healing, did suggest some level of platelet activation occurring via specific pathways, thrombin and arachidonic acid.
So some activation, but is it harmful? What about repeated treatments?
Good question. Another study looked at multiple HBO treatments. It found no adverse effects on platelet aggregation, their ability to clump together, or on their basic energy metabolism.
Were there any changes?
Interestingly, yes. They saw an increase in the protein content within the platelets and increased activation through that arachidonic acid pathway we mentioned, but not through another key one involving collagen. And one more detail in smokers, the platelets' oxidative metabolism actually increased by the 20th treatment.
So putting that all together for platelets.
I think the takeaway is that while HBO clearly can influence platelet activity, sometimes measurably so, especially with repeated sessions, there isn't strong evidence from these studies to suggest it causes major problems or significantly increases clot risk under normal clinical use.
It's definitely complex, isn't it?
Very.
Okay, let's move to a really cutting-edge area now, stem cells. These amazing master cells that can self-renew and become other cell types.
Yeah, this is exciting territory. The potential for HBO to influence these cells therapeutically is, well, It's significant. The source briefly covers the basics: embryonic stem cells, hematopoietic stem cells, or HSCs.
Those are the ones that make our blood cells, right? Used in transplants.
Exactly, already used for genetic blood disorders, immune deficiencies, even gene therapy. And the bone marrow also houses mesenchymal stem cells, MSCs. Though, admittedly, how HBO affects MSC specifically is still being actively researched.
But there are some promising findings already.
Oh, definitely. The source highlights how HBO seems to boost diabetic wound healing, partly by increasing the number of stem cells circulating in the blood.
How does it do that?
It appears to stimulate the production of nitric oxide, NO, which acts as a signal to mobilize these stem cells from the bone marrow. There's even evidence that HBO can trigger MSCs from bone marrow to produce a specific growth factor, placental growth factor, or PLGF, potentially helping to build new blood vessels, vasculogenesis.
And the source mentioned a table about neurological applications.
Yes. Summarizing animal studies, it's really compelling. It shows synergistic effects when you combine HBO and stem cells in models of neurological problems. Things like helping neural stem cells mature into neurons, promoting nerve regeneration.
So, potential for stroke recovery, nerve damage.
The animal data strongly suggests that, yes, it definitely points towards potential clinical uses that need more investigation in humans.
Absolutely fascinating. Okay, let's broaden out again to the whole immune system. How does HBO treatment impact our overall defense network?
Well, the source points out it can be a bit of a double-edged sword, seemingly. It can act as both a stimulant and a depressant, and which effect dominates often seems to depend on the pressure used and the specific model being studied.
So, it's context dependent again.
Very much so. You see a rat study where the thymus gland key for T-cell development first shrinks slightly, then gets bigger after exposure at 2 ATA. Then in guinea pigs, 2.5 ATA increased T lymphocytes, but 5 ATA seemed to depress their function. But then human studies at 2.5 ATA showed increases in both T and B lymphocytes, and also antibodies, the immunoglobulins.
But then another human study found no major immune effect after 20 treatments at 2.4 ATA.
Exactly. See? It's complex. And yet another study found a temporary shift right after a single high-pressure session, more CD8 T cells, fewer CD4 T cells, changing that important CD4-CD8 ratio.
So the picture is still developing, it sounds like.
It really is. The source also mentions observations suggesting HBO might stimulate lymphocyte production after surgery and improve infection resistance, and there's evidence for a potential benefit in type hypersensitivity, think anaphylaxis, maybe asthma, possibly by reducing IgE antibodies.
Any other immune effects?
Yeah, potential benefits in other hypersensitivity types too. Maybe by boosting the complement system for type 2 and 3 reactions, and some evidence for benefit in type 5, the delayed reactions.
What about transplants? Immune rejection is a huge issue there.
Right. And HBO seems to have a modulating effect here too. The source talks about potential mitigation of rejection, maybe by suppressing autoimmune-like responses, reducing certain inflammatory cells while increasing suppressor cells.
Interesting.
There's even a mouse study showing better engraftment of gene-modified stem cells with HBO. Generally, it seems to help normalize some aspects of immunity and reduce problematic immune complexes in some contexts. Also, altered expression of MHC class I molecules, which are involved in immune recognition.
So beyond these specific immune cell effects.
Stepping back, you have to remember HBO's fundamental actions: improving tissue oxygenation, reducing free radical damage, helping maintain struggling tissues, accelerating wound healing. All of that likely contributes to its overall benefit in many situations, including those involving the immune system.
Okay, let's shift focus a bit to plasma, the liquid part of blood, and overall blood volume. The idea that enough oxygen can dissolve directly in plasma to support life, that's kind of mind-blowing.
It really is. The source brings up that famous life without blood study in pigs at 3 ATA. They survived with almost no hemoglobin for a significant time purely on dissolved oxygen.
Incredible. And this is used clinically.
Well, the principle is applied. Hemodilution thinning the blood during open-heart surgery combined with HBO relies on this dissolved oxygen. And animal studies have shown researchers keeping animals alive after replacing almost all their blood with a fluid just using pressurized 100% oxygen.
Amazing. What about how high oxygen interacts with anemia in general?
There's a dog study mentioned. When anemic dogs were hypoxic, their bodies tried to compensate, increasing oxygen uptake and heart output. But when they were given hyperoxia, those values actually fell.
Why would that happen?
The researchers speculated it might be due to a redistribution of blood flow within the capillaries, maybe diverting it away from some areas when oxygen became plentiful.
And what about hematocrit levels themselves during HBO? Does it go up or down?
Seems the findings conflict a bit.
Really?
We talked about studies showing a decrease in patients over multiple sessions, but there's also a dog study cited where hematocrit increased at 3 ATA.
An increase.
Yeah, though the researchers thought it might be an artifact of the experiment. Maybe the spleen contracted under anesthesia, releasing stored red cells, just shows how experimental details can influence results.
Right. Now, the source also mentioned using HBO with oxygen carriers, like artificial blood.
Yes. There's a really striking rat resuscitation study described. Animals had severe blood loss, even respiratory arrest.
Yeah.
Those treated with an IV fluid called hetastarch plus HBO at 2 ATA
Yeah.
had significantly higher survival rates. Compared to getting the same fluid plus 100% oxygen, but just at normal pressure, 1 ATA.
So the pressure made a big difference there.
It certainly seems so in that model. It highlights potential synergy. The study also stressed, importantly, the need to manage body temperature during resuscitation too. It's not just about oxygen.
Okay, let's bring this into the clinic. Specific applications of HBO for blood disorders. First up, major blood loss hypovolemia, acute anemia.
Yeah, critical situation. The body's response to hemorrhage is complex. And blood transfusions, while life-saving, have risks, infection, compatibility, plus issues for people like Jehovah's Witnesses who refuse transfusions.
So HBO comes in as a kind of bloodless transfusion.
That's the concept. By maximizing dissolved oxygen in the plasma, you buy time, support tissues, even when red cell count is dangerously low.
Other examples?
Yes, the source mentions a case report of a Jehovah's Witness with severe anemia surviving thanks to HBO, and a small study of 3 patients with life-threatening blood loss anemia who showed dramatic hemoglobin improvement with HBO.
What about larger studies?
A bigger study of 26 patients is discussed. It found that while patients already in a very severe neurological state didn't make it, others definitely improved with HBO. The key takeaway seemed to be that starting HBO early is crucial for better outcomes.
And animal studies back this up.
Yes, they generally show favorable effects of HBO on recovery from significant, though maybe moderate, acute blood loss. It all comes back to that dissolved oxygen becoming vital when red cells are scarce. The source even talks about calculating an oxygen supply index.
So the conclusion for severe anemia is
That HBO looks like a valuable, cost-competitive tool to reduce the oxygen debt when transfusion isn't an option or is refused. Potential roles in trauma, emergency departments, ICUs, maybe even battlefield medicine.
okay, next. Hemolytic anemia, where red cells are destroyed too quickly. Sickle cell disease is the main example given.
Right. In sickle cell, low oxygen triggers that abnormal hemoglobin S to deform the cells into that sickle shape. They become fragile, break easily, causing chronic anemia and block small vessels, leading to those incredibly painful vaso-occlusive crises, or VOCs.
And the idea is HBO combats the low oxygen trigger.
Exactly. Break the cycle of hypoxia, sickling vessel blockage, more hypoxia. There's a rabbit study showing HBO reduced sickle cells in the eye.
What about in people with sickle cell crises?
The evidence looks promising. Anecdotal reports, plus a retrospective study showing significant drops in bone pain scores during VOCs after HBO. Also, a trend towards needing less morphine.
Any specific cases?
Yes, a patient with a blocked retinal artery and vision loss who improved after exchange transfusion plus HBO. And an 11-year-old with priapism, that painful, prolonged erection common in sickle cell, who finally got relief with red cell exchange and HBO after other treatments failed.
So useful beyond just the pain crises.
It seems so. The source also notes HBO's use in hemolysis from mismatched transfusions, suggesting a broader application in managing red cell breakdown.
Now, thinking about the brain, blood disorders can cause strokes, right? Can HBO help there?
Yes. Primary red cell disorders like sickle cell or thalassemias can definitely impair blood flow and oxygen delivery to the brain, raising stroke risk. These conditions don't just affect oxygen binding, they change cell shape, flexibility, increase blood viscosity.
Making it harder for blood to get through?
Precisely. So the source points out that HBO doesn't just boost dissolved oxygen, it might also improve some of those blood flow characteristics, the rheology. Think hematocrit, red cell deformability. This combination could be beneficial for cerebral ischemia and its after effects.
Is there evidence for that?
A study is mentioned where patients with cerebrovascular disease treated with HBO showed improvements. Lower hematocrit, lower blood viscosity, less platelet aggregation, and better brain oxygenation, all without the hematocrit going up.
So, multiple benefits converging.
Seems like a multifaceted positive impact on brain oxygen supply in that context.
Okay, one last point from the source, a specific contraindication, or at least a warning: congenital spherocytosis.
Right. This is an inherited condition where red blood cells are abnormally round and rigid, not flexible like they should be.
And the concern with HBO.
The worry is that the high oxygen environment might stress these already fragile cells even more, potentially increasing hemolysis, making the anemia worse.
Has this actually been reported?
The source says they didn't find specific reports of this happening in the literature for patients needing HBO for other reasons, but the recommendation is definitely caution.
So what should be done?
Close monitoring for any signs of increased hemolysis if someone with spherocytosis needs HBO. Maybe consider vitamin E supplementation as an antioxidant. And be prepared to stop the HBO if hemolysis does worsen.
Got it. Prudent advice. Well, we have certainly covered a lot of ground today, really plunging into the depths of HBO and its intricate relationship with blood and immunity.
You really
To
have.
sort of recap, it's clear HBO isn't simple. It has this incredibly diverse range of effects on, well, pretty much all the blood components in the immune system, too.
Absolutely. From red cell flexibility and survival to platelet activation, stem cell mobilization, shifts in immune cell populations,
Right.
it touches many areas.
And we've seen some really promising potential applications, particularly in managing severe anemia when transfusion isn't possible, and maybe easing some of the complications of sickle cell disease, plus those fascinating interactions with stem cells and immunity.
And I think, as our source really underscores throughout, continued rigorous research is just crucial. We need to fully understand how it's all working to really optimize its use in these conditions.
Definitely. So as we wrap up, thinking about this complex interplay, oxygen, blood, immunity, it really makes you wonder, doesn't it? What other maybe unexpected applications of HBO might emerge as we get a deeper handle on these fundamental biological processes?
That's a great question to ponder. The potential feels quite vast.
It certainly does. A field definitely ripe for more exploration. Thanks for joining us on this deep dive.